welcome everyone to the Pyramid Game, the Retina edition. For those in our virtual studio audience, the rules are simple. Each team, consisting of 2 contestants, will be a subject in our pyramid. One is going to give the clues, the other is going to give the answers to said clues, in hopes of aspiring to get all 7 questions right, or all 7 words correct, to gain a point for each word correct. The teams will only have 120 seconds to correctly guess all 7 words. And again, 1 point for each word. 3 teams will be competing today. The highest scoring teams will move on to our final round, our final Jeopardy round, if you will, but this is Pyramid, not Jeopardy, which you can tune into on June 12th. Be sure to root for your team in the chat box. We'll be looking for encouragement. We'll be looking for camaraderie, maybe some criticisms, and let us know what you think in the chat. All right, so let's get into it. Team 1, please come to the stage. Our first team is known as Team Peloton. And I'm pleased to welcome...
It's Pelotons. Eyes like us, Peloton.
Pelotons. The Pelotons consists of Dr. Mark Blumenstein. He's currently Director of Optometric Services at Schwartz Laser Eye Center in sunny Scottsdale, Arizona, and is President of MRB Eye Consultants. His teammate, Dr. Jeffrey Gerson, is in private practice in Kansas with both ODs and MDs in an integrated care setting. And he has an emphasis in retina care, which will hopefully help his team move forward.
So. We hope.
But definitely the best dressed team. So
yes,
our second team.
Yes, we are. Game to play.
Our second team, not to be underdone, are the Boston Buckeyes. So let's get to know Dr. Mary Beth Yackey, who is partner and owner at Eye Care Partners in Cincinnati, Ohio. If you were at Vision Expo East this year, you may have heard her talk about putting the O in OCT. So it's clear she's proud to be a Buckeye. And she's joined by Dr. Mile Brujic, a partner of Premier Vision Group, a 4-location practice in Northwest Ohio. He's published more than 450 articles and actually wrote them all. Now let's ask... Now, of these 2, you can see that some of them have more emphasis in retina and maybe some less. They are graduates from the New England College of Optometry, our second team, and that's the Boston. So some Boston roots here. I don't know.
Oh, yeah.
You know. So there were actually Buckeye trees on Beacon Street outside of New England. So it was a little known fact. So there's a connection there. Must have been some long-term Buckeye fans that planted them. All right, and finally, last but definitely not least, team number 3. Let's give a warm welcome to our third and final team, the Intrepid Sisters, Dr. Cecilia Ketting and Dr. Carolyn Major. Dr. Ketting practices at the University of Colorado, School of Medicine, Department of Ophthalmology in Denver, Colorado, while Dr. Major is an associate professor and director of the residency programs at Northeastern State University, Oklahoma College of Optometry. We have a little more mountain time. I guess it wouldn't be West Coast time, it's mountain time there, right?
You got it.
So that's our mountain time team if you're regionally cheering for these optometrists. And your name comes from both being members of the Intrepid Eye Society. Is that right?
You got it. Absolutely.
I've heard of it. Is that where you guys met? Is that how you met each other?
I think, Carolyn, I think that's where you and I first actually met, was through Intrepid, was it?
I think so, or maybe Mod Live, yeah.
Oh, maybe, yeah.
You're both looking extremely intrepid this evening,
Thank you.
and I am definitely intimidated. But fortunately, I'm on the other side of the competition this evening, as no one would be my partner. So just a reminder before we get started, players, if you get stuck on a word, you can pass. So either the reader or the guesser can pass and move on to the next word and come back to that word if you have enough time. Again, 120 seconds. If you try and cheat, I'm looking at you, Blumenstein. I will buzzer you.
I'm trying.
Trust me.
I am the judge, jury, and executioner of this panel, and I will buzzer you. You might notice me saying the word pineapple as our buzzer. All right. So the game is about to begin. Dr. Blumenstein and Dr. Gearson, if you can join us on the stage here to kick us off by choosing one of the categories you'll see on the slide. If you two can come to a consensus on a category.
Ooh.
What's the team's decision? Team Pelotons?
Pelitons.
Pelitons.
Where do you want to go, Jeff? Should we go with like usual suspects?
I think so. I was gonna say there's a lot
Kaiser
of
Soze. Oh, did I give away one of the words? Sorry.
a lot of good categories. Yeah, let's do that, Mark.
No buzzer yet. No
Let's take
buzzer
the
yet.
usual suspects.
All right. So team one is taking the usual suspects, and Dr. Blumenstein, you will be reading the clues or giving the clues, and Dr. Gearson, you will be the guesser. You will be guessing, and we'll be keeping track of score behind the scenes. I'll give you the okay to move forward and move things. So let's get those clues loaded to Dr. Blumenstein.
Okay.
Oh man.
All right, and are we ready?
Focus,
We have
Mark.
we have 120.
All right, Jeff. Come on, stay with me, buddy.
I'm with you. Hang on. I'm all right. I'm ready.
120 seconds. No texting, you two.
Nope. Hands are
120
here.
seconds starting now.
It's when you have sweet tasting urine. We worry about that, so we look in the back of the eye for this specific thing.
Hemorrhage. Microaneurysms.
Nope. So
Gastrointestinal.
it's sweet tasting urine. You're right there. But what is the specific thing that we're looking at to make sure that there's? Yes.
Good.
Okay. It's something that's wrinkled in the center of your eye. Yes. It's when you have something that's blocked and it's not an artery.
Retinal vein occlusion.
Okay.
Retinal vein.
It's something that happens in the center of the eye as we age.
Central serous.
Nope. It's one of the highest risk factors of smoking or just getting old.
Macular degeneration. Age-related
Yes.
macular degeneration.
Okay. It's something that I had in my eye that
Retinal
it's like a
detachment. Horseshoe.
It's,
Retinal.
yes.
There you got it.
Hey,
Wow.
it's something
1 minute left.
when a patient complains about lots of floaters and you're like, oh, that's very common. It's usually
Vitreous
something right. Well, more specific.
Posterior vitreous detachment.
Yes. Okay. And it's the stuff that's way far in the retina that I'll never see.
Ora
And
serrata.
No, it's something even less common than that, or more common than that. It's
Ciliary body.
it's something like if you had a garden, you would have
Lattice
this.
degeneration.
What kind? Way out there.
Peripheral lattice degeneration.
Woo! This is how it's done, Carolyn. This is how it's done.
Oh,
Congratulations, team number one.
I
Congratulations.
think what we might have to do is see how much time we have left.
26
and donate it to Cece and Carolyn, because I think that Mila and Mary Beth don't need it.
You have
Noted.
30 seconds
Noted.
left. 30 seconds left. So don't forget, this is only half the competition. We have to flip this around.
I know.
Round two.
I know.
So
I don't know that.
don't get ahead of yourselves.
Maybe you
So-
donate
But
yourself.
that was an excellent
Yeah.
performance.
I don't know that I would have gotten any of those.
that you got to start off strong, set the standard. Sorry for making it difficult for the rest of y'all.
Yeah, there you guys
I
go.
don't think you are.
All
right.
I think we are.
Excellent job, team number one. All right, let's go to game number two with team number two, our confused Ohio Bostonites, our poisonous nuts from Boston. Let's welcome Dr. Mary Beth Yaki and Dr. Nile Brujek to the stage. And in this round, we'll have Dr. Yaki giving the clues. Dr. Brujek will be guessing. Again, 2 minutes. What category would team number two like?
Mary Beth, what do you think?
Oh my goodness.
Pressure.
many
This
good
is the
options.
real pressure.
How about
Yeah.
did you see? How about did you see that?
Sounds good.
All right. Did you see that? We'll take that one. Did you see that? Signs and symptoms of age-related macular degeneration. So you're going to be describing to your partner these clinical signs or symptoms that may be noted in a patient with previously undiagnosed age-related macular degeneration. Can we please load the clues to Dr. Yaki? And let me know when you two are ready to rock. Again, 120 seconds, 7 words. All right. 2 minutes for Team Boston Buckeyes, starting now.
So something that is distorted, irregular,
Metamorphopsia.
Woo.
something you cannot see. It's black.
Blind spot.
Another word for that. You got
Pass.
this.
Pass.
Okay.
I'll get it.
Sometimes the eye turns red. After an injection, patients think they're really, really hurt.
Uveitis, hyperemia, conjunctivitis,
Read the
So it's
word
like
again.
they're really, really
conjunctival
hurt. but really
hyperemia.
no pain, and it's really red. Sometimes with
subconjunctival hemorrhage.
But,
I'm going to ask
with
Dr.
diabetes.
Yaki to read the word again. Read clue number 3 again.
Oh my gosh. Okay, let's try that again. Sorry. I didn't say it out loud, did I?
Nope. I'll let you go.
All right. So this is something that you'll have with wet macular degeneration, and the patient will
Metamorphopsia.
have also, it's a sign, it's not fluid. It's another sign that you will see with macular
Blood,
degeneration.
hemorrhage, choroidal neovascular membrane.
So deep red in the macular area.
Hemorrhage, subretinal hemorrhage.
There you go.
There you go.
Good. And then the next one we're going to go on to is this is what diabetics get, and their vision gets blurry.
Metamorphopsia, diabetic shift.
So then we treat it
refractive
sometimes
shift?
with medication. It's right in the center of their eye.
Diabetic macular edema.
Perfect. Next one is when there's weird vessels growing, and they can grow anywhere. They can grow in the iris.
Neovascular membrane, neovascularization.
Perfect.
Great.
The next one is when there's like some people
10
describe
seconds.
it as a macular degeneration as having no vision in this area because there's missing the lower layer of the retina, almost like the carpets run raw.
Geographic atrophy.
Time's
Close.
up.
I am not good at this game.
Great job. You guys did an excellent job.
Good job, Eli.
I'm just so proud, Mary, that you were thinking about the front of the eye. You were thinking about hemorrhages and subconjunctival hemorrhages instead of
Retina
subretinal
edition.
hemorrhages.
My bad.
So I'm proud of you for that. All right. So good job, team. Excellent work. Again, the game is not over. This is just round 1.
Round 1.
But we do have team number 3 here, the Intrepid Sisters. We'll see if they're true sisters, if they can read each other's minds, if they speak in sort of twin tongue.
Sending the vibes your direction.
And so Dr. Ketting and Dr. Major to the stage. What category would you ladies like?
Carolyn, do you have a
I'm gonna-
preference?
Go for it. Take a picture. It'll last longer.
Win. Let's do it.
All right, so the fun house of the pyramid game, Retinal Edition. Take a picture, it'll last longer. Let me pull that up here.
Okay, so it's going to me. So I'm gonna be trying to get you to guess.
So Dr. Ketting is going to be reading. And Dr. Major will be guessing. I have 2 minutes on the clock. Let me know if you are ready, Dr. Ketting.
I'm ready.
All right, 2 minutes starting now.
We use this to look towards the back, into the back of the eye.
Direct ophthalmoscope.
Perfect.
Slit lamp.
Yep, you got it. We take pictures
Bonus
of the back of the eye.
OCT.
Um,
Color photography.
yeah,
Camera.
you got it. So we use this other thing. This is another type of machine to look in the back of the eye, but to look at the layers.
Oh, OCT.
But what does that stand for?
Optical coherence tomography.
Got it? We use this to look in the back of the eye, but we inject dye into the hand.
Oh, intravenous fluorescein angiography.
Yep. We take pictures of the back of the eye, but we're also looking, it's the alternative for fluorescein angiography that we're using.
Fundus autofluorescence.
You got it. I'm gonna skip that one. The thing that we're looking at the back of the eye to look at the different layers, but now we're looking at the blood vessels.
OCT angiography.
You got it. What does the OCT stand for?
Oh, optical coherence tomography angiography.
There we go. And then not large, but the opposite of and around.
Microvascular.
Like
Vascular.
another word for around.
Surrounding. Adjacent.
When
30 seconds.
Wide
so
field.
around your house is the like on your property.
A moat.
The princess in the
The
castle.
lawn. I don't
I
know.
wish I had that. Small and around. Words for. You have the
8
first
seconds.
part.
Micro.
Something with that.
Microperimetry.
Oh, you got it with 1 second.
I like moat better though.
I live in a castle here in Telephone.
I love this.
I think that is
That
by
was
far the
impressive.
best answer for any of the questions so far.
Yeah. We should end the game right now. Moat. The moat.
All right, we're ready for round 2. Let's get team 1 back up here. Dr. Blumenstein will now be the guesser. Dr. Gerson
no.
will be the clue giver. And we'll need, you guys get, again, first pick at round 2 for categories.
Yeah, Jacob, we're going to take risky business.
Risky business is AMD risk behaviors. You're going to describe for your partner these modifiable and non-modifiable risk factors that may be associated with the increased odds of developing age-related macular degeneration.
Okay.
So this is risk factors for AMD.
I need help.
So, yep, you're going to do great. I have strong belief in you. Those necrograds.
May or
So
may
we
not
have 2 minutes on the clock. Do we have clues in hand?
clues in hand.
Let me know when you're both ready and we'll start the clock.
I am ready when you are.
Do it, Jacob.
All right, 2 minutes on the clock, starting now.
How old are you? You're
Age.
not Asian, but
Hispanic.
continent.
Non-Asian.
Not
continent.
American.
Oh, Asia. Asia.
Not Australian. Not Antarctican. Not South American.
European. Yes.
Yep. Take a puff.
Smoking.
I ask people if there's anybody they're related to.
Hereditary. Genetic.
Anybody in your
Family. Familial.
family, and then another word of having something. Your family.
Trait. Family
If
genes.
they've had a disease. If they've had
A family diagnosis. Does anybody know?
your past, your family. Okay. Look, first.
Skip it. Let's go to the next one.
Okay. Fat, overweight.
Obese. Obesity.
Yes. Heart has problems.
Cardiovascular.
Has problems.
Cardiovascular disease.
Yes. Not low.
High blood pressure.
High.
High.
Not skinny.
High fat.
The foods you eat.
Oh, high fat diet.
Yep. Let's go back to the last one. Your
Okay.
family. Has anybody in your family had
30
this
seconds.
condition? Do you have a family blank of this condition? I'm going to take your blank to know why you're here.
History.
You got it. So say the first word, then that word.
Family history. Hereditary.
Family history.
Great. We'll count it. Great work, guys.
Cecilia, you look scared. You should be, because this is how you do it. This is how we do it. Yeah.
I am
Mila's
the
got
worst clue
music.
giver. It's official. Good job, guys.
Mary Beth Yaki, you can bring it on home.
Great work by the Pelotons.
It's Pelitons. Pelitons.
Pelotons. Good job, gentlemen. Let's bring team number 2 up to the stage. Here we have our Boston Buckeyes again.
Let's do it.
And what category would the Boston Buckeyes like to give, with Dr. Brujic being the clue giver, Dr. Yaki being the guesser this round?
What do you think, Mary Beth?
Oh no,
There's only 2 options.
Work in progress?
Sure, we are a work in progress. We got this.
Let's do it.
this.
I like that style. I'm an energy guy and I like that style.
There we go.
All right. A work in progress. Biomarkers associated with AMD progression. So biomarkers associated with macular degeneration progression. You're going to describe for your partner these biomarkers that are known to be associated with the progression of age-related macular degeneration.
Yeah.
I think of these as clinical findings.
Jacob, did you seriously give us the most difficult category here? Oh
I
my!
did not choose,
some of these are untranslatable.
I have to say, Mila, though, he didn't give it to you. You chose it.
You chose it. And Mila, think of it as like base curves, or think of it as like,
Mary Beth, we got this. And Jacob,
you've got the right person guessing.
If it's 2 words, can I say 2 words?
I will allow it.
Okay.
Ooh.
All right.
I will allow it. And yeah, just break it down. I think you got it. Let's send the clues over. And I have 2 minutes on the clock. I am ready when you are. Again, biomarkers for association of progression. Are we ready?
All right. I'm ready. Mary Beth, you ready?
Let's go. Let's do this. We're work in progress. We got it.
All right.
Work in progress, starting now.
Okay, 2 words. If you're not small, you're...
Tall, big, large.
Yes. And what are those small little white things in the back of the retina with somebody with AMD?
Large drusen.
Correct. Another finding in macular degeneration, it doesn't look smooth, but it starts to get mottled.
RPE atrophy.
So this is...
granular.
So 2 words. First word is something that... What's the tone of the skin made of?
Pigment.
Correct. The second one is, what happens if it looks like this and then 2 days later I have darker pigment? What's a word to describe that? Pass. So this next one is kind of what you would see if you're looking in the retina and you're actually seeing a little area that you can kind of see through.
Atrophy. Geographic atrophy.
You're getting close, but it's the clinical finding that it's the way that you would describe it in your clinical notes.
Hypertransmission defects?
Yes. Okay, so this is something that you would find in an OCT finding. Remember the thing that you said about the small little things that you see in the retina of macular degeneration? Yep. But what is it if it's a fake one of those?
Pseudodrusen.
Yep, there's a word in front of that.
Reticular pseudodrusen.
Yes. So this is what you get when you have something that's leaking. You have macular degeneration that's
Wet macular degeneration.
This is something, so it's the region of the retina and you get blood vessels growing in that region.
Choroidal neovascular membrane.
So it's 2 words. The first word is the region in the back of the eye.
Retina.
Macular. That's the first word. The second word is new blood vessels.
Macular neovascularization.
Yeah.
Macular neovascularization is it?
Yeah.
Yes. Good job, team.
We got hypertransmission defects. We got hyperreflective foci. We got fluorescent liquids.
Hyperreflective foci. We didn't get there.
Oh man. My word.
That was pretty amazing.
But Mary Beth, I'll tell you, some of the ones that you got, I cannot believe you got. I cannot believe you got.
Yeah.
Very impressed by reticular pseudodrusen.
That was really good.
That makes 2 of us.
I don't even know what a
Okay,
reticular
Carolyn.
pseudodrusen is.
I hope we do not have a. I hope it's not like that.
Landmark finding.
Oh boy.
All
They're doing
right.
that on
So
purpose.
team number 3, Sisters from Another Mister. Landmark findings is what we're left with. Let's welcome them to the stage. And landmark findings, normal and abnormal retinal architecture. So you're going to describe for your partner these structures, regions, pathologic findings that may be located in either the normal or the abnormal retina. And I believe we have Dr. Major reading the clues and Dr. Ketting guessing, is that correct?
Yep.
All right, and so let's load the clues, and I'll load 120 seconds on the clock. I'm ready when you ladies are.
I'm all set.
All right, clock starts now.
This is a region of the retina right in the center.
Macula.
One word.
Macula.
Yep.
Fundus.
An infarct of the nerve fiber layer. Looks fluffy and white.
Not drusen, but
The first word starts with like a plant.
yes, it
The
does.
second word comes from like a sheep.
Cottonwool spot.
Yeah.
Okay,
Cottonwool
great.
spot.
The next two are like layers. The first one is a brown layer in the retina. Oh, I can't say it. Oops.
Okay, skip that one.
Pineapple.
Pineapple.
The next one. This is a blood vessel layer that's underneath Brooks membrane.
The choroidal.
Yeah, keep
The
going.
choroidal vascular layer.
Yeah, what's the technical term for that? Blood vessels, they're fenestrated.
50 seconds.
Give me some other. So it's the choroid.
Yes, a layer of that.
A lot.
Most anterior, just underneath Brooks membrane of small blood vessels.
It's not coming to me.
This is a deposit of
Drusen.
great.
Yep.
And then this is another type of deposit that's has more distinct borders.
Exudate.
Yes. Oh, this one's so hard. A region
15
right
seconds.
in the center of the retina that doesn't have any blood vessels.
Avascular.
Yeah, there's a technical term for that. That's 3
yeah.
words.
It's your foveal
Yep.
centralis.
Oh,
Time's up. Oh, so close. Great
Okay.
job, everyone. That was a lot of fun. I hope you enjoyed it. You all did excellent. Let's see your scores.
Oh, jeez.
Yes.
All right. Leading the pack with 14 out of 14, the Pelitons. Did I get it right?
You got it.
Pelitons. So 14 out of 14 for Dr. Blumenstein and Dr. Gerson. Team number 2 scored 9 out of 14. Ooh, this is really close. So team number 2 has 9 out of 14 for the Boston Buckeyes. And team number 3, our Intrepid Sisters, 10 out of 14 for second place by 1 point. So teams 1 and 3 will be moving on to round 2. Thanks everyone for joining us. Thanks to these amazing teams. What an amazing contest. Came down to the wire at the end. Again, thanks for joining us, audience. Stick around for our program by Astellas up next.